The Chief Medical Officer recently warned that current non-COVID excess deaths is being driven in part by patients not getting statins or blood pressure medicines during the pandemic. But when looking at the data on statins in openprescribing.net, which is based on monthly NHS prescribing, there appears not to be a drop. So where is the evidence? And if there isn't one, what is causing these excess deaths? Will the Minister commit to an urgent and thorough investigation on the matter?
Well, we are seeing an increase in excess deaths in this country, but we're also seeing that in Wales, in Scotland, in Northern Ireland and across Europe. And there are a range of factors. There is an increase, as we saw in December, in the number of people being admitted with flu, with COVID and with other healthcare conditions. And this is not something that's just seen in this country, but across Europe as well.
Bridget.
Thank you, Mr. Speaker. The ONS have not issued mortality data by vaccination status since the 31st of May last year. Can the Minister confirm that her department have collected this data for the rest of 2022, and can she inform the House when it will be published?
Well, I'm very happy to write to the honourable gentleman with that information. But can I just be clear that we absolutely planned for an increase in admissions this winter. That's why we got on and delivered over our plans for 7,000 extra beds. It's why we brought forward our flu and COVID vaccination programme and lowered the age for those who are eligible for those. There are a number of factors which are the same factors which have driven excess deaths across the United Kingdom, but also across Europe.
Shadow Minister Andrew Gwynne.
There were 50,000 more deaths than we would have otherwise expected in 2022. Excluding the pandemic, that is the worst figure since 1951. The Health Secretary, part-ostrich, says he doesn't accept those figures. But as many as 500 people are dying every week waiting for essential care, and we're still getting the same old Tory denial and buck passing. So will the Minister, in answering, finally take some responsibility, accept the ONS excess death figure and recognise the damage that she and her government are doing to our NHS?
Well, I prefer to deal with facts and then the BMJ has ranked the UK mid-table in Europe for mortality figures, comparable with Italy. In fact, Germany has got higher excess deaths at 15.6%, Finland at 20.5% and Poland at 13.3%. But if he wants to hear about what's happening in Labour-run Wales, with the statistics which are available on the gov.wales website, Wales in December had the highest number of red calls ever, and only 39.5% received a response in 8 minutes, the lowest on record. These are clinical reasons for excess deaths, not political ones, and perhaps he needs to recognise that fact.